Yeah, what are some of the pain points with like a diagnosis of dementia? I mean, obviously, I think education is a large part of it, of like what's actually going on, like how long is this going to take and so forth, but also financial. And maybe there's some other pain points that I'm not aware of. So I guess as you've developed the company and as you've started to analyze data about what needs to be done for these individual patients and their care plan, what are some pain points that are you're running into for these patients?
Yeah, I'll say, information, like you mentioned, it's a big thing, right? Really understand the disease and make sure that the people around you understand the disease, right, that you have, right? So, when we think about, when I think about, dementia, right? Dementia is a set of symptoms, right? Of not being able to perform activities, your daily activities properly, memory, thinking, all those element gets deteriorates over time, right? And you see, folks are, when you talk about dementia, they all say Alzheimer's, right? Alzheimer's is a type of dementia. Alzheimer's is actually the disease that causes those that have, if you have those diseases, you experience those symptoms, right? Alzheimer's, of course, is the largest, is the most people, 60 to 70% of people who experience dementia symptoms are diagnosed with Alzheimer's, but there are the type of dementia, if you, or a type of dementia, right? Different diseases, just to be correct, because I've read, wherever you go, it's like, okay, when, it's like, okay, Alzheimer's disease, then I get vascular dementia. So it shouldn't be vascular disease or something that
Mm-hmm.
causes. So even the nomenclature, it's a bit confusing.
Right.
So you have, I think it's about 11 different type of dementia in quotation, or things that fall under the category of dementia. Alzheimer's is the biggest one. You have frontotemporal dementia, vascular dementia, Lewy body disease, Parkinson causes dementia as well, and there are a few ones, a few other ones. I think they're very small. I don't even remember their names, the extra names. So information first, is just like really understand what the person or the loved one is experiencing, and also, there is discrimination in the system, in the healthcare system, right? So the latest Alzheimer report or fact sheet on dementia, shows like 50% of African American experience some type of discrimination, right? Seeking help, for someone with, so for or their family members, who have dementia, right? I think Latinos or Latinx, it's like 40%. No, Native Americans about 40%, it's about 36% for Asian, and around the same number for Latinx. So, not only, information is scarce, but also there's discrimination. When you think about the provider themselves, right? When you think about the geriatrician, right, there should be kind of the front door and supporting those, be the reference point, right, for information, to where to find information. That number is very small. There's not enough geriatrician in the country, right, to support the folks who are experiencing dementia. So that's a very small number. You go to your primary care provider, but not all primary care provider can really diagnose effectively whether or not you have dementia, or support you in that process, right? So there's, right there's an issue. Um, and of course, there's some great work that folks are doing throughout the nation. Right here, Emory is doing some great work with their dementia, their integrated dementia clinic, or integrated memory care clinic, they call it, IMCC, in the community here in Atlanta. But of course, right now the reach is limited to just in the city. I know they're working hard to expand that. So the support, for families is limited. There's that stigma based on race. Also, the planning piece, when you think about, there's a lot of decision that you have to make as a family, as a primary caregivers, that for that person as well. When do you stop? When do you stop? When you take away their driving license? Um, what, from a financial, that's an expensive disease to have. It's very expensive, right? So planning has to be number one. So where do you find the folks that can give you the right advice around financial, around legal, right? So remember, your loved one may be there physically, but they're losing, their cognitive function. So when is the time that you need to make that decision to take away things from them? So to protect them, but you still have a person that's leaving, so there is that interaction that sometimes could be very difficult. So how do you educate those, not only information about the disease itself, but also how do you educate those primary caregivers to react better and to expect a few things that's going to happen, right? Someone asking you, and I know one of our advisors, his wife has mid-stage dementia, and she's asking him on a daily basis, is it Sunday yet? Right? He understands where everything is coming from, but sometimes he loses his patient and maybe raise his voice. And someone who has that disease, you're raising their voice, they're becoming paranoid because they feel like that you hiding things from them, right? So it's like, and you're not, right? But they think, right? You're like,
Right.
it's like, oh, you don't care for them as much. So there is, so there's a lot of pain points. So, for me, I think about when I think about that, caregiving, the friction, it happens from a interaction with your provider, interaction with different service provider in your community, friction between your loved ones, right? That who wants to make decision, and fighting what needs to be done to better care for that person. Planning, finding the right folks in the community that can support you to make the right decision from a financial perspective, from a legal perspective.